Okay, we are officially 1 minute after one, so we'll go ahead and get started. First off, I want to welcome everybody and thank you for attending today. I think that if you have not yet connected with your public health partners and the people that are using or doing the overdose response strategy in your neck of the woods, this is a great opportunity to connect and to form future partnerships. So with that, I will turn it over to Jordan, who will talk a little bit about the overdose response strategy.
Awesome, Amber. Thank you so much. Good afternoon, everyone. Happy to be with you all. For me, it's a rainy day. I hope you all have sunshine where you're at, as we're spread over many states. So I'm just going to do a little bit of an introduction to who we are and who the ORS is, and to some of our attendees who you will want to connect with in your states. So I'm Jordan Friend, and I am the public health analyst for overdose response strategy in Montana. And my partner, Will Janish, he'll be talking in just a minute. I'll let you introduce yourself, Will. But we make up little two-person teams in the states. And so we've got some of our two-person teams attending today. So I'm looking through, I see Ashish is on. He is the PHA for Hawaii. So if you live in Hawaii, he is who you're gonna wanna reach out to, and I'll put contact information in the chat for everyone. And I see Haley Hayden. She is the public health analyst, so the PHA position like me for Wyoming. So if you're in Wyoming, Haley's your gal. Let's see who else is on. Sorry, just scrolling through really quick to find our partners there. Okay, and then we've got partners like Will. So we've got Will Janish, the drug intelligence officer in Montana. And we've got Casey Patterson. So he's going to be your drug intelligence officer for Wyoming. Rico is going to be your drug intelligence officer for Hawaii. And then Eva is currently the drug intelligence officer in Alaska. So we've got people who you can contact. And while Will is talking, I'll put their contact information in the chat so that you know who you can talk to. But I just wanted you to be aware that a couple of them are on right now and you can reach out to them. So the overdose response strategy is a program that is very collaborative. It began like in 2015 in the eastern states, think like Washington, DC, Baltimore, that kind of area of the world, and has been slowly trickling west. So in our western states, we're pretty new teams. I started in March and my partner Will started in September. So we are the first people to be doing this in Montana. And the goal of the overdose response strategy is to reduce fatal and non-fatal overdose in our areas. And we do this through strategic partnerships, data sharing, best practices, and specifically relationships between law enforcement and public health. So from what I understand, you all do a lot of local coalition work. And so you're probably going to be falling more under like public health, local coalition area. So the point of this collaboration is so that public health and public safety are talking more often. We're talking about similar things, and we're using the same data to talk about what overdose looks like in our areas. And so some people, when they hear overdose, are only thinking opioids. We're kind of looking at the broad range of overdose in our areas. And so this can include all sorts of stimulants, narcotics, and drugs. So that's a little bit of who we are in the ORS. If at some point there are questions, I'll have our PHAs and DIOs from other states be able to talk, but I think it's just presenters at the moment. So I'm going to turn it over to Will to kind of talk about the nuts and bolts of how we want to operationalize this work. So in Montana, we're working with Odmap, which is a visualization tool to see where overdoses are happening in our areas, whether Narcan is being deployed, whether they're fatal or non-fatal. And this is a nationwide tool that we can use. Our hope is then to build off of this tool to be able to respond quicker in an overdose spike situation. So previously in Montana specifically, but it probably is similar in your states, we have quite a lag between when the state gets information about overdoses or a cluster of overdoses and how fast we can respond to that spike. Our numbers, we're looking at like about 14 days to respond to an overdose, which if you work in that world is not adequate. That the moment has passed, your time to respond and do any prevention work has passed. And so with Odmap, we are able to respond in near real time to these overdose spikes and clusters and work towards prevention and mitigating harm for communities that lay around our more urban communities. So our more urban communities in Montana, maybe Alaska and Wyoming can relate to this, probably Hawaii too. We don't have a lot of actual urban areas. It's a lot of smaller towns that maybe have, 10,000 people in them. Our biggest town has 100,000 people in it. And so there can be spillover that happens from your more urban areas into your rural areas. And so we are hoping to respond quicker in overdose spike situations to prevent the spillover from happening and to make sure that what's happening in our more urban areas isn't as harmful and deadly. Okay, so I'm going to stop rambling, but happy to be here with you all and figure out how we can work together. So Will, if you want to. So I'm just going to share my screen of a couple documents, and then I'll work with Amber to get these out. These are Montana documents, but I'm sure in your state with your ORS team, you can do something very similar. So let's just pull up the first one. So this is our spike response plan. This is mostly Will's work. He's incredible. So there are a couple of tools that you may have seen from ASTO or other places, Nacho, that have created spike response toolkits and frameworks or guides. We've linked those here. A lot of those documents are 40 and 50 pages long. And so what Will and I tried to do was condense that information to a front and back sheet. And so that's what we have here is our implementation plan. That's just a front and back sheet that kind of shows you, okay, we're going to define what we're trying to do here, that when we can respond quicker in a spike response, we can help mitigate harm and death. Maybe why an overdose might be happening in your area, why a spike might be happening, why we need a community response at the community level instead of at a state level. All our communities are very unique. You all know this and we know this. And so what are the resources that you have in your area? What resources don't you have in your area? That kind of thing. And what we are aiming to do, which is reduce the number of injuries and deaths from overdose. So our steps are to identify your partners. We've created a template, which I can share, that where you can just plug and play who's doing what is their contact information, that kind of thing. Developing a plan. What do we do? How do we detect a spike? This is where Odmap and Will come into play, or your DIO, in detecting if a spike is happening. We also want that second piece of if a spike is happening, let's verify if it's actually a spike. Is this clean data? Is this real data? Is something funky going on? Are people putting in information that's the same? The system pulls out duplicates really well, actually, but we just want to make sure that we're not working with bad data to start out. And then how do we set up who's going to do what when we actually do have a spike? So now that we've decided that a spike is happening in your community, who's responsible for what and how do we get information out to the locals? So this is kind of just the front and back of our spike response plan. So the next piece of this is, I'm just sharing the next thing, what it looks like, just a quick little template of communication, who can do what. So this would be where we would fill in information across the board at the local level of who's doing what. It comes pre-populated with our state information and so Will and I's information. And over here, we've got a responsibility tab. So this column allows us to let you know exactly what you can expect from us, how we want to support you. And then you can do that same for each of your partners in your medical community, your treatment and recovery people, your first responders, EMS, your public safety, who's doing what. Do you have a college in town? So you have campus safety, thinking through all these different layers of public safety, and then your community supports, which is where a lot of you guys are going to be. So in these local coalitions, this allows us to kind of have all our partners in the same place and have a record of how we've decided we want to respond in a crisis. And then the last piece that I wanted to share was we created a little press release template. This was one of the areas where we saw a lag in time at the local level, being able to turn around a press release for their area about a spike. And so we wanted to make it really straightforward and quick. So, some information about what's going on, what does it look like, what have we seen in our area, and then we put in common information about signs of an overdose, that you should call 911 if there's an overdose, information in your community about resources, Naloxone, those kinds of things, Good Samaritan law to protect those around someone experiencing an overdose, and then a place to put your community resources. So we wanted to be as plug and play as possible, and as light a lift on the local people as possible. We also created some social media graphics so that you could respond quickly and pump out some information to your local community via social media in the event of a spike. So that is kind of the next steps from Odmap. So it's kind of like get onboarded with Odmap, learn what that is, learn the data, understand how that looks in your area, and then implement a spike response plan. So that's kind of what we got going on. Amber, Will, did I miss anything that you want to add?
I guess I forgot to tell everyone where we're getting our data.
Oh, great.
So you understand where the data is coming from. Right now we're onboarding and I think we have over 80 agency accounts now. We are working to onboard our first hospital with an emergency room. We have police departments, sheriff's offices, EMS, tribal law enforcement entities, fire departments, county coroners, county public health, as well as state Department of Public Health, the FBI, the DEA. We're working with the Bureau of Indian Affairs to get them access to the system. And then we are getting users for the Naloxone program. We're getting users for some of the people working in treatment. And everybody has the ability to put data in. It's very easy. It's very forthright and not a hard process at all to put that information in. And like Jordan says, there is a tool in place to prevent duplication by date, time, and location. And I do all the training for all the agencies as they onboard for their agency admins. So they can all use the same format to try to prevent those. And then I also scrub the data, especially for the fatal overdoses every quarter. I will scrub the fatal overdose data. And then if I find any errors or duplications, I work to remove that for the state of Montana. And I know Wyoming does it a little bit differently, but they also have a very great data that they're collecting. They just have a different approach to it because they have different systems they're working with. But it is a great data set, and we are working to perfect that. But that's some of the people contributing data at this point.
Right, and our data only gets better the more we have people inputting it. And Will's correct that the people who put in the data own the data. So you own what information you put in. And yeah, we're really lucky in Montana to have consistent training from Will. I saw a question, but I think Amber was handling that, so I'll move on from that. So yeah, that's kind of the rundown of what we've got going on.
So I do have a question for Will. Just because we're very interested in promoting naloxone use of all of the fatal overdoses, I don't expect you to know all your statistics off the top of your head, but an estimate of how many of the fatal overdoses had naloxone already on board?
The vast majority are not, but I can pull it up right now.
The vast majority of our fatal overdoses in Montana are happening someone alone and without naloxone. So that is a common thread.
Yeah, so one of the things that I'm going to put into chat, there is a great harm reduction website called Next Distro. And so across Montana, every state has their naloxone distribution map. And we can plug those into the chat boxes too in a little bit. So there's many distribution sites across all of our states. And if you live in a remote area that you don't have easy access to get naloxone, you can actually have it mailed to you through nextdistro.org. And in Montana, I only know Montana, I don't know anybody else's stuff, but that's distributed through Open Aid Alliance here in Missoula. And so it's great if you live out in the middle of the country, or, you know, you can get a couple of doses of naloxone, and, you know, naloxone of course saves lives. And the state here has done a great public service announcements about promoting naloxone use and carry. I made my kids, I gave some to my kids, I made them put it in their car.
That's great, Amber. Yeah. So Will's putting in another resource for naloxone in Montana. Maybe, you know, Haley or Ashish, if they wanted to put in resources for their states about where you can get resources there.
Yeah, that's great. So other questions from the group about the partnership or anything else that was presented so far? Do you want to just raise your hand and we can promote you? Or feel free to stick it in chat. Is there car decals to inform those we have it on board? No, but that is a brilliant idea.
That's awesome.
I never thought of that idea. Great. Mark, you have your hand up. So Maynette, can you promote Mark to speak?
Hi, folks. When you're talking about agreements and working together and sharing information, does everyone within each coalition need to sign that agreement if we're sharing that during a coalition meeting?
For I guess, what do you, everyone who wants access to Odmap has to sign a participation agreement.
Okay.
And that is, there is some, it's pretty standardized what that participation agreement is, and it kind of lays out how you do data sharing. But if you're talking about sharing information in Odmap, they also have a built-in memorandum of understanding that you can do between organizations. So like if the Montana Department of Health wants to share their data with the Montana Division of Criminal Investigations, they can do that MOU. There's a special tab for that in Odmap, and to start that conversation and to put that in place.
Okay, great. Thank you.
Right. But if you are in a meeting and you're sharing data and information, we can work with you so that that data could be shared to like a group of people. So yeah,
That's kind of the way it works for us. They all have signed participation agreements with us, but we haven't done anything as sensitive as this before.
gotcha.
It would be great to be able to share it with them across our whole region and all the different areas. Other question is, do you have anything for Guam, Saipan, or American Samoa?
Guam, yes, correct. No, wait, it's Puerto Rico.
No, there's one who does the U.S. Virgin Islands, and I think, let me pull up. I know we have a DIO that's working on those.
Yeah, great question. And we've got a question in the chat about whether entities in Alaska have implemented Odmap. Great question, Barbara. And I included Eva's contact information, so she'll be your point of contact for Alaska. But yes, they're working on exactly the same thing that we're working on. Mark, you're off mute. Thank you. So they're working on the exact same thing. She doesn't have a public health analyst yet, so I think they're still getting their team up and going. But definitely, if you have questions about Alaska, Barbara, I would reach out to Eva. So I put her email in the chat.
And Eva is entering data into Odmap. I just checked.
Great. Thanks.
And I'm trying to find, so Rodney is our US Virgin Islands DIO, and then I can drop that information into the chat as well for those people. So Rodney, and then his PHA's information will follow, and they cover the US Virgin Islands in that area.
Awesome.
Ashish has great information for us. Thank you. Guam and Saipan are not part of HIDA yet, but there's partnerships that work with, so Rico is his drug intelligence officer as needed. So yeah, your Hawaii team is a really incredible team who, if you're kind of working in that space, I would partner with them.
So, you know, we kind of planned this for the presentation piece to be the first like 40 minutes and then take a little break. But I'm going to crowdsource, and because we want to have an ongoing discussion about not only making those connections that we are already doing in the chat box, but also some potential projects that people might have ideas about, or, you know, forming a specific coalition regarding prevention of overdose. So does the group want to take a mini break, or do we want to just power through and end early? Power through. Okay, Kyla's the only one that gets to vote. Power. Great, great. Sounds good. So I'm going to share a little bit about even some discussion I just had yesterday in a Missoula coalition. And it really is about meeting patients where they are. And that the power of harm reduction and acceptance of people where they are, and so that they are comfortable asking for help, because recovery is possible. So we do want to utilize these HIDA grants or any kind of these tools to identify the spikes, but we also need to get to the prevention and recovery portions as well. So I know that in my area, we have a substance use disorder coalition that is basically manned by the United Way here in Missoula. But is there, and I know that Kyla is on the webinar, and there is something specific for the state of Alaska too. What kinds of things are present statewide or in larger communities for Hawaii and Wyoming? Is there anybody know? And we can actually, Maina, why don't you promote everybody so that they can speak as as panelists, and just feel free to jump in.
Amber, can you ask the question again, please?
I was wondering what kinds of statewide coalitions are present specifically in Wyoming and Hawaii, because I think we know the ones in Montana and Alaska.
We have a plan here in Hawaii that we've worked on for a while. There's about 6 or 7 different groups through the Hawaii Department of Health. Harm reduction is one of them. So we would be very interested in kind of going forward to find out who else works on this work. Maggie and I recently found out that HSAG from California is actually doing some work here also on opioids. So we're going to try to get together with them and see what work they're doing. And then we have worked with the drug enforcement group who has come out to our coalitions and has given presentations. This was pretty much before the pandemic, but we would like to get started again with a new plan and a new strategy. But I'm sure Maggie
So-
could add other to this.
Tell you what if everybody that knows of a statewide coalition, those resources, if you put that in chat, who the contact person is and the name of the group, I will compile a list for everyone and then send it out to everybody that registered so that we can do those personal kinds of connections and make sure that people are talking and we get the right people to the right groups. Does that sound like a plan?
Yes, it does.
Anything specific in Wyoming?
Yeah, so statewide, it's a little bit difficult. We have different agencies that maybe we reach out to, but to be all involved in one collaborative approach, it's a little bit harder, especially because with Wyoming, we're so scarce and we're so spread out, and getting different agencies who can even handle like being involved in a type of coalition. They just say they don't have enough manpower or they don't have the kind of resources that they need. But I know in Cheyenne, where I'm based, we definitely have quite a variety of different coalitions that we work together. And on the Narcan Naloxone approach, we have our state like Department of Health that they have their own funding that we're actually currently looking at, seeing if we can get funding to other smaller counties, seeing where the need is. So they're going to start looking at their data to see what can we do to start bringing it to our smaller cities that don't really have the funds or the capability to do what a bigger city like Cheyenne can do. So statewide, no, but it's something that we're definitely trying to work on to see if we can bring each other together in a better way.
Awesome.
And Haley, this is Haley Hayden. She's the public health analyst for ORS for Wyoming. So thank you for coming off mute. And Ashish should be able to come off mute at this point. Do you want to just do a quick intro of yourself?
Hi, everyone. My name is Ashish Amrjani. I'm the public health analyst for Hawaii. And I was just typing into the chat, but I'll just tell you since I'm unmuted. As Mark was saying, there is the Hawaii Opioid Initiative. I dropped the link for their main page in the chat. So that's the main kind of statewide coalition for our state. It's organized by the Department of Health, but there are different work groups for different interests. So there's one for pharmacists to learn about dispensing naloxone through pharmacies. There's one for law enforcement and first responders. I think probably for this audience, the two most relevant work groups would be the data collection work group and the treatment providers, which is like a collection of all of the rehab and harm reduction partners throughout the state.
You're awesome. Thank you so much.
Other questions or partnerships that you think that are important to form?
I am a certified behavioral health peer support specialist with a treatment center in Hungry Horse, Montana. I don't know if we're a partnership, but I'm curious as to how we can make that happen or what our role would play as far as being an inpatient treatment facility. I guess I was just curious about that.
Corey, I cannot believe that you are also in Hungry Horse, Montana. For those who don't know, Hungry Horse is a town of like 600 people. Well, I think you and I should meet. I put my information in the chat, Corey. If you want to shoot me an email, let's chat about this. Let's talk about it.
Awesome, thank you.
And Corey, just to add to that, we are working with like Rimrock in Billings and other ones. So that's already in the works. So yeah, meet with Jordan. She's super excited now. She doesn't have to drive very far.
All right, thank you, you guys.
And Julia up here. Oh my goodness, this is so exciting. Okay, well, we're gonna just start a little glacier flathead something thing going on up here.
That's too funny. Any other kinds of conversation that people feel like need to be had regarding these partnerships, or any questions regarding the overdose response strategy?
Amber, there's just one thing I wanted to add. When you think of the ORS, and I hate to like have it clearly defined, I always tell my partners with public safety, if it has a drug nexus, give me a call and let us see what we can do. And I think that goes for our public safety and our coalitions too. You know, sometimes it's very simple requests. A lot of people are struggling with the data, informing people in their community why it's important. So if it has a drug nexus in the state of Montana, give us a call, and I'm sure my partners in the other states agree. And we'll see what we can work with, because one of the things I've learned in this position in the short time I've been here is we have to be extremely flexible and responsive to the needs of the people we're working with. So I don't want them to think that, oh, you would call them if we have something on Odmap, or we call them if we need an overdose response plan. Call us if it has a drug nexus, and we'll talk to you about it.
Yeah, and Will, on those same notes, I know that you've talked about, well, that one was meth versus an opioid. Is that clearly defined in OD maps?
It's getting better. So a lot of the times with the API, at least, we're working. So like I just did a training with a bunch of fire department paramedics to expand their knowledge of when they're entering the information into their systems. Sometimes they skip a step, or they put it in the notes and that's not picked up. So I'm trying to refine that process by doing outreach with the people that are entering data. But for our fatals, yes, our fatals are very, very good. Usually we have the toxicology in there of what drugs we found in those fatal overdoses. Our non-fatals, it's kind of hit or miss depending on how long they've been utilizing the system, and have we met with them to go over that yet.
And is that true because of the fatal overdoses, the toxicology report, which comes in probably months afterwards because it goes to the crime lab, but the non-fatal ones you might not be able to access due to privacy issues, the reports from the hospital?
No, most of the time they're not sure. We have a very big problem with mixed toxicology or drug use. So a lot of people are mixing the drugs they're utilizing. So like we see a lot of times where they'll mix it fentanyl with methamphetamine or cocaine. And so the people are hesitant to put in their notes, like, exactly what the drug type is. That's why a lot of times we see other narcotic or other opioid, because they're not sure. They know it's presenting as a classic sign of an opioid overdose, but they're not sure what opioid they took. They don't know if it's heroin or if it's fentanyl, or if it's fentanyl mixed with heroin. So that's something we're working to overcome, but that's going to take a lot more effort and some time. But we are working on it.
Awesome. I have one other question, and this is related to the Good Samaritan laws that are present in different forms across our state regions. And I think that it's underappreciated how the Good Samaritan laws can be a harm reduction strategy in and of itself, because people are more likely to call for assistance and therefore save lives. So could you just say a few words, and not about specific Montana versus other states, but what makes a strong Good Samaritan law?
Do you want that one, or do you want me to have that one, Will?
As Jordan knows, I didn't help write that. So Jordan, you can take that one and I'll throw it in big S. I pulled it up and just dropped ours in the chat, but yes, Jordan, you can take that one.
Yeah, so your best friend is to read the law in your area to learn what it looks like in your area. So does it protect Does it protect everyone from if they have drug paraphernalia and all that kind of stuff? So you want to look to the extent that your Good Samaritan law is protecting people, but here in Montana, it is protecting those bystanders of someone experiencing an overdose, that they would not get in trouble if they call the cops. There's an interesting study that was looking at the amount of people around someone who is experiencing an overdose. And when you're, with a few people, 2, 3, something like that, the amount of people who will call 911 and get a response is much higher than if you're in a larger group. So it's strange that a larger group of people can have a negative impact, negative health impact on people. So just, there's kind of interesting, I think you get some of that group think, or you assume that someone else is calling 911 on this situation, and then it's too late. And as most of us know, with fentanyl, these overdoses can happen incredibly quickly. So our time to respond is really short. And so that was a surprise to me. So it might be a surprise to others as well. We'll put the link to the information for Good Samaritan Law in Montana in the chat for those who are interested in educating themselves. And I'm sure you can easily look it up for your other states.
Mm-hmm. And again, I don't know if you know the stat off the top of your head, but most overdoses do occur when people are alone.
Yes, the vast majority.
Mm-hmm.
The one thing I would point out about a Good Samaritan law that I would like to see, one is the coalitions knowing what their Good Samaritan law is, but also when they're giving out Narcan or providing Narcan training to their communities, I think it would be highly beneficial to educate people while they're giving Narcan out on the Good Samaritan law, because everything we put out is don't use alone, use with a buddy. And so you can use Narcan, but I don't think we do enough to promote those Good Samaritan laws and exceptions to people, so they understand that you can give them Narcan, you can call 911, and you can stay there and continue that level of care without facing prosecution when law enforcement arrives. Because in a vast majority of these cases, law enforcement is going to be one of the first people on scene. And there's that stigma that's around officers that they're going to show up and they're going to arrest everybody. And then when EMS is going to get on scene, they're going to take care of the patient. And that's just not true. And that's not, we have to overcome that stigma that surrounds it. And I think coalitions are huge with that, especially when it comes to Good Samaritan laws and educating people because they have so much contact with these people and with their loved ones. So if they can educate them on that and spread that knowledge, I think that's the benefit of it.
Yeah, and we have to remember that in Montana, our first responders tend to be our law enforcement. They tend to be in most areas quicker than fire and EMS. So your law enforcement actually tends to be the people who are administering naloxone if they're first on scene. So building relationship and trust with law enforcement is hugely important to this work. It's a lot of what Will and I are doing, and primarily Will, but what we are doing, I'm working to get on that. He's been on the job longer than me. That's what I'm going to blame it on. But yeah, so is to build that trust, and so that law enforcement feels supported in that work, because they are on the front lines and they are experiencing administering naloxone at a pretty high rate, at least in Montana.
Yes, and I think I guess I can't speak for all communities in Montana, but that has the actually carrying of naloxone on the person has definitely increased in Montana by leaps and bounds. So that's great. Any other questions or conversation that you feel like needs to be had around this topic?
We can connect you with services for doing naloxone training in your area. If you feel that your area does not have a lot of people who are naloxone trained, Will and I can help with that in Montana. So if you're feeling like that's a need in your area, just let us know.
Okay. Well, going once, going twice, everybody speak up or forever hold your peace. Thank you so much, Will and Jordan. And I hope we have lots of really good connections here moving forward. Like I said, I will put together a list of everything that's in chat just so that people have resources if they didn't have a chance to connect to everybody. So if you don't want your email shared, put that in the chat because otherwise I'm probably going to share it. Okay. I'll let you guys all have some time back in your day, and thanks for attending.
Thanks,
Thank
Amber.
you.
Mhm.
Amber,
Bye-bye.
thanks, everyone.
Thank you, everybody.